Hello, homeopaths. Recently, I conducted a webinar on the topic of thermals in homeopathy. Here is the recording of entire session.
Discuss. Okay, so in today's session, first of all, we will see that who has from our early pioneer worked well on this topic of thermals, right from the inception of homeopathy to current date. We will see the entire aspect. Okay. So there is a wide, canvas in front of us where there are different peoples through the different decades in homeopathy has worked on this topic. And here we are not to propagate, not to blindly follow a single school of thought, but rather our efforts is to make a bird eye view of uh, every contribution that is done in this part of thermals, and we have to choose the main aspect. Okay, so first, okay, so this slide is little bit changed. Actually, I made it on my old laptop, and when I uh, sent it on this Canva, they have automatically chosen this. So the word is that thermal compass or trap. So I remember when I was working in Aditya Hospital as a student at that time, there was another uh, student like me, and she was treating the receptionist. Means the receptionist was there, and she used to work every night. And when she got sick, she felt that there is a long queue in front of our senior sir, and so instead of giving entire case to the Nikam sir, she felt that she should consult this our internee, which is my fellow colleague. Okay, now she has taken her case well, understood every aspect, and finally given her a remedy. She was very confident. The main concern about this receptionist was her thyroid. Okay, so TSH was raised, not too much, but it was somewhere 8 9. Then she was having all the constipation. Then she was having this all restlessness. She used to work very hard, very talkative, confident, and all this kind of stuff. Okay, considering all these things, my colleague has given her remedy. Unfortunately, that remedy didn't work at all. The remedy given was pulsatilla. Okay, that was given by my colleague. Now, as the remedy was not working, finally this receptionist went to our senior sir, Dr. Nikam sir. Sir has taken, asked another assistant to take the case and finally given her remedy, Nux vomica. Okay, so the choice of remedy was Nux vomica. Now the perplexing question was to that my fellow colleagues and to me also, that we have taken case well, consider her as a very much hot patient, consider her night duties, her nature, her thirstlessness, her ability to interact confidently, socially, energetically, zealously, and given pulsatilla. Now, okay, we accepted that it might error from our side. We could not understand the patient well. We followed this case for next few months. Her thyroid became entirely normal. TSH decreased. Her all constipation went away. Now the $1 million question that remained was how the simple day-to-day friend-like person, this receptionist on duty, who was working there since many months, how we can miss the thermals. And she was clearly saying that she needs fan and all. Then how this hot pulsatilla has suddenly become chilly Naxomica when she went into the chamber of Dr. Nikam sir. And this was a question for me also. Okay. Then, uh, based on this theme, I treated in my Satara clinic many interns who are doing night duty in various hospitals. Those who are attendees, they also might have experienced that they are doing some night duty for the financial purpose, for the experience purpose, and this is a very good thing. But I remember there are many interns whom I use Naxomica. There are many staff nurse, okay, whom I use Naxomica. Now, while choosing Naxomica, yes, the thermal aspect is one of the important aspects, but its core essence, PQRS, is elements from loss of sleep, overexertion, workaholic. So I think you are wise enough not to make mistake to give every nurse Naxomica, not at all, isn't it? सो हर एक नर्स को तो नक्सोमिका देना नहीं है, लेकिन अगर ये सिचुएशन लाइफ में आती है तो भले वो पूरी तरह से कॉन्स्टिट्यूशनल मे बी शी इज नॉट एट ऑल कॉन्स्टिट्यूशनल नक्सोमिका, बट a phase comes where she has to work hard. Number one, she has to wake up night, the thyroid affection, glandular affection, and constipation. Now this whole bunch of symptoms with the thermal somewhere in that cascade is solving our puzzle. So it is like a jigsaw puzzle. Now, when if you are very stubborn, now he's a hot patient, hot patient, and how we can even think of Naxomica, then you will be seeing a large variety of cases. Now, when we were doing IPD round in Sir's hospital, then also we see sometimes the single remedy was enough, and when patient was entered in, single remedy was given, he was kept on same remedy for 1-2 days, some weeks, and then he was discharged, no problem. But in large variety of cases, in vast many cases, there used to be 3-4 remedies, not at all at one time, but after one another. So one remedy was given, no response. Then the case was reversed, second remedy, third remedy. Then many times the question was in my mind, the first remedy is pulsatilla, second remedy is silicia, third remedy might be some mercury. Now the thermals are changing with each remedy, isn't it? Then how can a person who is admitted right in front of me, the patient whose case was taken by us, suddenly changes his thermals? Are you getting my point? Okay, so there are some waiting room in Zoom. Please check it and if possible add.
Hello, Rahulji. You have the host now, so I think it's
access now. Okay.
Yeah, can you set them?
So what to do? So am I how to? Okay. So I think I have to stop sharing for a while.
Okay, 1 second. I'll claim the host again and accept all of them.
Okay. So after each 10 minutes, we will take this kind of break, right?
Yeah, and I will give you the
there is long list, long
while. Let me see if everybody's there. Yeah, now I can give you a host back, I think. Yeah, Yanu, you can share again now.
Okay, so everyone is enjoying the session. Are you all with me? Quickly chat box, say yes, no, or anything. Dr. Sarang sir, happy to see you. Megha is here. Yes, Nitin. Dr. Nitin, Dr. Bhumika, yes, you are finally here. You are asking for correcting, but I am happy that you are here. Reena, Dr. Parshuram Patel, yes. Happy to see everyone. And quick, we are going to the screen share now again. Okay, so I was the someone is again in waiting room. We have to. Okay, so we will not discontinue for a time being. So what I'm telling you is a very pure experience, unbiased experience that we are every time when sir used to give some remedy, out of 15-20 people, there are 4 or 5 confused faces whether it was hot or chilly. Now they were with this same book in their hand because it was sir's own book. Then they used to again confirm thermals and all. So what is the reason that even when patient was admitted, then also we have to use the remedy with different thermals? Such as I have talked about the pulsatilla, silicia. Then there is a long list of remedies in homeopathy where complementary tables where sulfur, calcarea, lyco. Can you imagine? But it is there. It is a fact. Causticum, staphysagrus silicia. Then there is lachesis lycopodium. Then there are so many complementary remedies in homeopathy. Ignatia, lachesis. These are inimical actually. Okay. So there are so many relationship of remedy. Now there is one person who has done extensive work on the thermals is Gibson Miller, the same person which you are right now seeing on your screen, Gibson Miller. Okay, we will take it for approximately 30 to 40 minutes more because this is just an overview. Now you can see he's an orthodox doctor, graduate in medicine. He was deeply influenced by Dr. Kent So if you open the Kent repertory and the last part of this Kent repertory, there is one, annexer or supplementary chapter where they have beautifully documented how to use the repertory. Okay. Now this Gibson Miller has a wide contribution. He was very workaholic man. I came to know about some history that he has three sons, out of one was lost during World War. There is tough, very in spite of very tough time, in spite of with very few financial gain, he worked hard to make this. Okay, so you can see Gibson Miller's hot and cold remedies in germ Kent's use of repertory, synopsis of homeopathic philosophy. There is a wide work of this man, really celebrating. Okay. Now, what is right in front of you is, if you can zoom. So this is a Gibson Miller's list. So you can see in the ambithermal there are only 4 fire remedies: mercury, Bicac, natrum carb, cinnabar, and improved, aggravated by both hot and cold, aggravation over heating and over radiating. Though many symptoms may be amelioration by heat. Okay. Then there is remedies that are predominantly aggravated by heat. So right from the Aspulus, Alum cepa, aloe to it steps down to the Vespa viburnum, which is used for dysmenorrhea. Okay. So this is a list from Kent repertory that you must know. Now I have gone through the Kent's lecture thoroughly and found this reference very crucial. Just a minute. I found this reference is very crucial. Right now, what you can see here is Kent's opinion from the lectures in philosophy. So what Kent says, the substitution of one remedy for another cannot be thought of or entertained in homeopathy. Substitution of one remedy for another cannot be thought of or entertained in homeopathy. So आपके पास अगर आज पल्सेडिला नहीं है तो आज के लिए कलकेरिया दो और फिर पल्सेडिला देंगे? No. Okay. So there is no, what word it is given in the organon. There is no dash dash in homeopathy. Please type in chat box. He must individualize things widely, dissimilar in one way, yet similar in another way. Take, for instance, the 2 remedies, sickle and arsenic. Both are chilly, but patient wants all the covers off, okay, and wants cold air in sickle and wants the things hot in arsenic. So arsenic is also chilly, sickle is also chilly, but there is some more minute differences between these two that we can see in the Kent's lecture. Okay, a mere bookworm, symptom hunter would see no difference in between sickle and see. This Kent's language is very harsh, very to the point. Kent, even if you take Dr. Samuel Hahnemann himself, mongrel sect, there he has written, the faith should await him, and if they are went into the same disease condition, they should die also in same way. So Dr. Samuel Hahnemann has written that if a person who is doing like this mongrel sect or unethical or immoral practice, when they themselves falls in, when they themselves suffer, they should be treated in the same manner. It might feel like so much offensive or so much revengeful kind of language, but yes, that was the language, but that was very harsh. Similar way, see the last interesting sentence: a mere bookworm, symptom hunter, would never see difference between sickle and us. In this Phatak, book, there is a word called sensitive to both. Okay, so for a time being, keep aside all thermals. For a time being, keep aside the work done by Dr. Nikam sir in his book. For a time being, keep aside Dr. Vijayakar sir's list. For a time being, keep aside Gibson Miller list. Right now, we are focusing on one remedy book, that is Phatak. Okay, Phatak is considered as one of the most amazing and reliable book. And why it is reliable? Because it is written by a very learned practitioner of homeopathy who is by profession, by degree, an MBBS fellow. What is the importance of being MBBS is not only that he has some additional qualification or some allied qualification. No, the thing was that he was very keen student of pathology. That's why he has documented this entire pathological aspect of each remedy. So if you open the ipecac, okay, what we see is oversensitive to heat and cold in the first sentence. So right now in front of you is Fatak's materia medica. And in Fatak medica, you can see it is affected by heat and cold. Now, when the case of ipecac comes in front of us, the patient is, kind of very hot, which we expect in a ipecac patient. And sometimes patient says that I can't tolerate cold air. ठंड में मैं स्वेटर लेता हूँ, अगर ठंड पड़ती है तो मुझे स्वेटर पहनना पड़ता है. The moment he utters this word, because it was imbibed in our mind that it is a hot remedy, it is very hot remedy, it is extremely hot remedy, we sometimes do eliminate it. Now here comes the risk. Okay, so can you see the slide clearly? Okay, now this slide is very important because this slide, those who are on Zoom, in Instagram, you can't see the slides. If you can, please join Zoom meeting. The link to the Zoom is in my status on the Instagram. Okay. So now what you can see in this slide very clearly is that there are some modalities which are given, that are considered as a both. Though ipecac is considered as a so-called hot remedy, but they are sensitive to cold. Go to the next, ferrum mate. Now, what is the thermal of ferrum mate? Everybody knows it. Those on Instagram also can answer. What is thermal of ferrum mate? It is extremely, predominantly, mainly chilly remedy, but there also comes worse by heat and cold. I remember I was treating one patient. She was a kind of mentally challenged girl. Then a second point about her was, she used to get some kind of temper tantrum. Okay, around 18 to 19-year-old girl, and in between, she used to get a very severe kind of temper tantrum. She used to throw the things. She used to, take clothes from the cupboard and throw on the other people, and otherwise she used to be very well. So she has one brother who was about to marry, and whenever some new marriage proposal used to come, so there is the ceremony, a small function where the bride and groom, prospective bride and grooms, meets in one meeting. And yes, Aniket, we will add you in few minutes. Okay, so there is one bride and groom's kind of conversation ceremony. In the middle of ceremony, she used to come and create a huge scene. So you can imagine the pains of patients, family members, parents. Already they are handling this challenge, mentally challenged girl. Plus, she was not allowing to get her brother married. Okay. Now, because of all this situation, they came to me. I tried one, two, three, four remedies, not responding. Then they told me one interesting thing that in the childhood, she had an episode of meningitis. Now, for the meningitis, there is a one important symptom is stiffness of neck. Okay, stiffness of neck. Now, based on the stiffness of neck, based on the hysterical patient, I choose a remedy, one remedy. Okay, but before that, I have given all the hot remedies like just a minute, I'll tell you the exact point in that case. So sorry, I have done multiple chili remedies, but in between she used to tell about the hot aspect also. Okay, means mentally challenged, it was really challenging mentally challenged or psychiatric patient to find thermals. So she used to make some confusion, which like we have given belladonna, hyoscyamus, moschus, stramonium, veratrum, and all kind of remedies. But finally, the remedy which helped her a lot was simicifuga, something which has done with neck stiffness like ignatia, something which has history of meningitis, and all kind of. Now here comes affected by hot and cold. Okay. Now, so this is all about Fatak. So my point is that though we have to compartmentalize the homeopathic remedy into the hot, chilly, towards hot, towards chilly, and ambithermal. If you see Fatak's reference, I have only included 2-3 remedies which are traditionally considered as chilly, but it has some hot aspect as well, or they are both affected by hot and chilly. We should not, like a knee jerk movement, rule out this kind of remedies because they have said something about heat aspect. I think you are getting my point very clearly. So simicifico is chilly, aromatic chili, ipecac is considered as a hot, but they have other aspect also. Because they have as other aspect, we might miss this remedy, or we might just आपण जेवणात माशी काढून बाहेर टाकतो. In the same way, we might just exclude that remedy entirely because of our preconceived obsession that this is a chili, this is a hot, and there is nothing beyond that. But there is multiple, gray shades in between them, and that we must know. We should not go to the extreme. So now we will talk about different schools in homeopathy, like ICR, like mind method, like predictive method, like the way in which Dr. Nikam sir is practicing, and Sankaran sir. We will take everything and we will try to analyze how they look towards thermal. So simplest is mind method. Now this is very interesting. I don't know much about this method, but there is a what I must appreciate is that they have made very good propagation of homeopathy in India. There are a lot of new homeopaths who are coming up, who are at least turning towards homeopathy because of this so-called mind method. Now, in this mind method, for even for hot and chilly, they use metaphor. For example, I am feeling chilly or I am feeling hot. Okay, so hot is a feeling of warm. Warm is a feeling of, somewhere you need a kind of warmthness of emotions, warmthness of behavior. And from this metaphor or from this mental correlation, they land up into some kind of rubrics and then they come to conclusion. Okay, so this is most what I can say, uh, difficult to understand and digest aspect. I'm not at all saying that this will not work and this is not wrong and something. No, I'm too small to comment on that. But what I can say is that within this entire discussion of thermals, this metaphoric use of thermals is the most recent and unique thing which even I'm not able to comment because I never used it. But this is the way, chilliness. Uh, in intermittent fever there is chilliness, so for that chilliness also they use some mind metaphor. You get knowledge, or if there are some. Yes, Aniket, so we will make a 1 second pause in this session and allow the attendees inside. I'll stop it. Narenji, can you please allow those who are waiting, those who are in the waiting room? There is Dr. Aniket is in waiting room, Dr. Swati or someone. Okay, so in between communication should not stop. Are you all with me? 25 plus, that's great. Are you all with me? So we are talking about school of thoughts. Is it visible, audible? That's amazing. Okay. So Narenji, are you there?
Yes, here.
Yes, Aniket. So can you allow this?
Yeah, already allowed. I transfer the host back to you.
Okay. Okay. Thank you. Now we will. I will again start sharing, and as we used to do in our college days, that those who come late should wait at least 10 minutes outside the room. So exactly same thing is happening. Now we will allow after 15 minutes or 1 hour, because that is breaking the chain of talk. Those who are attending this session, 2025, 2030 session, what I can assure you that you must not have encountered or have came across the presentation like this. I am not talking here a representative of some school. Yes, I have studied initially with predictive method when I was in college days. Dr. Bhosle sir was there. He used to attend the predictive seminar. I had been long time with Dr. Nikam sir. Now this is ICR, which is in front of you. We'll talk about Sankaran method also. See, the goal is very clear. This all stalwart has dedicated their life towards the betterment of homeopathy. So we should not make compartment. At the same time, we should make sure that this inflow of information should not disturb your base. So there is a Gandhiji's very famous quote that we should keep the doors of window open for the winds to come in. But at the same time, make sure that this wind should not shake your foundation of your building. I think you understood. I think you have understood the thing well. Now, what is in front of you is very meticulous, very detailed, very precision, precisionly made, what you call the word dexterous kind of stuff. So here, what you can see: temperature, weather, season, change, air, getting wet. So all kind of stuff in one chart. I think this should be in your mind. So it is not possible to ask each and every question for the each and every patient, but somewhere in the back of the mind, this information it should be there in your mind, right? So there is a so right now, those who don't know, or Narenji, or those who are not outside India, there is a huge group of homeopathy called as ICR, which is basically based on the Palghar. They have done excellent work in the very rural areas, especially areas where even conventional medicine fails to reach, like tribal areas, Adivasi, what we call in Marathi. So in these tribal areas, they have done a huge work for the homeopathy. They have one hospital, okay, which is running very excellently, and they have postgraduate course also. Those who are student attendees, they must visit this place. What a wonderful place! They have taken homeopathy to a new level, and the most important learning from this group is that they have made it very much research oriented. So Institute of Clinical Research. So there is no name of homeopathy in their name also. No mention of homeopathy. So that shows their dedication about the clinical and research part. So this is their approach. Then there is covering, uncovering, clothes, heavy, light, tight, loose, woolen, warm, general, local, cold in general, local, bathing, of course, hot, seasonal, hot or cold, sea bathing, and finally, what you can see here. Let me check whether I can take some. Okay. Actually, I wanted one marker, but let it be. So this is all about from the ICR, very meticulous. Every student of homeopathy must know about that. Moving on to the further, uh, worldwide famous method is from the from the school of Dr. Sankaran sir, or sensation method, and they have also evolved a lot. They have also contributed for the homeopathy wonderfully. One interesting thing, word that I came across, I was searching for the reference of this word, but I couldn't find it. But I clearly remember that Sankaran sir has said that snakes are cold-blooded animals. So lachesis can also be a chili. Yes, you heard it right. From their perspective, from their some analysis, this is the truth. Now let's go to the father. Father was P. Sankaran. Okay. So Zoom attendees, please join. Okay, sorry for interruption. So right now what you are seeing in your screen is a reference which I had taken from Elements of Homeopathy Madra Medica by P. Sankaran, Senior Sankaran, the one who has considered as one of the pioneer in Indian homeopathy, especially a Bombay school, what he recognized him as. So he went all the way from India to, I think, London School of Homeopathy by taking a lot of pain and a lot of hardship, and there he studied well and came back to India and formed an entire group of friends, homeopaths, who propagated homeopathy. Now, what he want to say about Calcarea carb? From the description in the Matra Medica, you feel that they are chilly, but sometimes they are not so. This is comment is not coming from any, Tom, Dick, and Harry. It is coming from one of the most responsible and uh, very renowned person in homeopathy. So what he's saying, you feel that they're very chilly, but sometimes they are not so. I have seen Calcutta patients who are as hot as sulfur, but unlike sulfur, even when they complain of burning in part, that part is cold. Okay, so this is one metaphor, not metaphor, but references from P. Sankran. There are again reference from P. Sankran on the sepia. The sepia patient is said to be chilly, But one must remember that typical sepia washerwoman of Dr. Tyler is also aggravated by heat of the room and heat of the iron. So you can imagine in your clinic, head to foot, there is a sepia patient. But while going outside, she says that doctor, तुमच्या खोलीत खूप गरम आहे. In your room, there is a lot of heat and I am not comfortable with that. Because of this sentence, if you are too much, it is too much ascribed in your mind repeatedly that CPH chili, CPH chili, CPH chili, and you came across this word, you might get confused. So you are taking so much ardent effort to individualize this patient, and unfortunately, because of this single modality, you might get confused, or you may feel that this might not be sepia, this might be natramur, which is also, disappointed, lean thin, or something like that. But here is a reference from Elements of Homeopathy from P. Sankaran that sepia has this modality and can give the remedy under cold and heat aggravation. Now let's go to the son, Rajan Sankaran sir. Rajan Sankaran sir has written in the Substance of Homeopathy about salts chapter that natramars was given. Natramars is generally chili remedy, but it was otherwise clearly indicated. In general, it is important to match the thermal. I think this match is what is cut while taking screenshot of this. But if a remedy is otherwise matching, otherwise very clearly indicated, a single modality should not rule it out. I hope you are hearing me very well. Single modality should not rule it out. Okay. Just a minute. Okay, are you all with me? You are getting the points which I am presenting you. You see, it is everything with a lot of meticulous reference. It is not, haphazard presentation, but you can type if any question in chat box. Just a minute. I'm making one important setting. Anyone, please unmute yourself and take a little bit pain to read this, whatever in front of you. Very important. Are you all with me? Anyone, please, because I cannot see the names of attendee. Are you there, Dr. Sonali Atoli? Anyone else?
Can I, sir?
Yes, who's there? Let me know the name.
Dr. Shilpa Patil.
Yes, ma'am. Always welcome. Please read this.
Yeah, can see reality for what it is. Every symptom is a symptom of delusion. Every symptom arises from a false perception of reality. If a person feels very chilly despite hot temperature outside, he is reacting to false sense of reality or delusion. Disease is a disturbance of the vital force. It is an expression of a false perception of a situation that does not exist. This expresses in mental, emotional, and physical spheres.
Okay, so this is something delusional aspect. Okay,
Yes, yes.
please read it. Next one. This is also very important, very precious.
The pulse
Can you
patient
read
is
the next
chilly.
slide?
Yes, sir.
Yes. Right, please.
The pulse patient is chilly, but is aggravation by warmth. I must confess here that I do not give great importance to chilliness and warmth because I have seen sepia patient who are warm and lachesis patient who are chilly. Under
Okay,
the rubric cold and heat aggravation, you will find remedies like pulsatilla, sepia, silicea, lachesis, etc., which we think are predominantly aggravation by cold or by heat. Again, our remedies were proved in countries with different climatic confine. We can do not know how far they will apply here. Exactly, There is, unless the patient is very markedly aggravated by the heat or cold, I do not consider this.
Okay, so this might be surprising for many of you, isn't it? The references that is coming here. So just so within 1 minute, within 1 to 2 minutes, I will summarize. Okay, within next 1 to 2 minutes, I will try to summarize whatever I'm talking about today. Okay, and then we will go to the next point. So what we have done, try to understand. We are trying to take a broad overview of thermals. We have started right from the Kent, isn't it? First of all, we have seen this Gibson Miller's work. Then this first list. Then we have seen Kent's opinion from the Kent's lecture on philosophy, where Kent's talk about a mere bookworm hunter would see no difference between the sickle core and arsenic. So where he emphasized the point. Then we have seen a lot number of remedies from Phatak Mantra Medica. Okay, in Phatak Mantra Medica, Phatak, who is considered as one of the most reputed name in the field of homeopathy. Who is considered as one of the most reputed name in the field of homeopathy, has also given both aspects. Okay, then we have seen Ferramate, Simicifuga. Then we have talked about mind method, where they talk about chilliness and warmth from the mental perspective. Then we have seen about ICR, where they have very meticulously, documented every point that must be asked in the cases of choosing thermal. Then there was Sankran method, a senior Sankran, who has given about Kalkirekal's hot aspect, Sepia's hot aspect, then delusional aspect. Now here what he talks about is if a person feels very chilly despite of hot outside. Okay, now it is a bad summer in India, and if there is a lot of heat outside but still is feeling chilly, either there is some disease or this is a kind of delusion. So this is a new understanding of disease by Dr. Sankran sir. Now here is the most important slide from Sankran group. Okay, so before going to the most important slide, we'll take just 1 second break. And Narenji, please allow those who are there quickly and share this again. I hope you are enjoying the session. Okay, this is very actually very innovative and new kind of understanding, which you will rarely see in any seminar, webinar, because we have covered an entire perspective. So the Pulsarilla patient is chilly but aggravation by warmth. I must confess that I do not give importance to the chilliness and warmth, because I have seen sepia patients who are warm, lacasis who are chilly, undoubtedly cold and heat aggravation. You'll find remedies like Pulsarilla, sepia, Silicia, lacasis. And where you can find this cold and heat aggravation, can anybody tell me? I think it is okay. And in the Kent, of course. Again, our remedies were proved in countries with different climatic condition, and we do not know how far they will apply here exactly. And unless the patient is very markedly aggravated by heat and cold, I do not consider it. Such a kind of comment coming from P. Sankran, one of the most reputed person in the field of homeopathy. We are not here to contradict or create a debate whether he was right and wrong, but somewhere in his huge practice, he must have encountered with this kind of patient who are thermally contradicting somewhere, but still showing the totality. Now here comes the next legend, Dr. Vijayakar sir. Now, as far as Vijayakar sir is concerned, okay, they have worked very extensively. So if I want to rank the top 3 person who was done very practical, handy, day-to-day useful work in the field of thermals. The first will go to the, of course, Dr. Nikam sir's book on thermals. Second is from Dr. Vijakar sir's work, and third will be Gibson Miller's work. Okay, these three are just, that you must have with you. So we'll talk about Dr. Vijakar sir's work and of course Dr. Amarse Nikam sir's work, undoubtedly the most extensive and practical work in the topic of thermals. But I have told you that in the first case itself, Naksomika, case of receptionist who was working on the night duty, that how there can be a twist in the story. So thermal materia medica is the book that you must have bedside. Now what is right in front of you, those who are online can take screenshot of this also, because this is very important. The core of the case, the essence of the case, the PQRS of the case are the main aspect. Okay, to support our choice, we have thirst, we have thermal, we have physical constitution. You must have word, you must know one word used for this. Can anybody unmute themselves and tell me what word we use for this thirst, thermal, and physical constitution? Hello, are you all with me, or am I talking to my tab only? I want your super interaction. I'm once again telling you that this presentation I haven't presented on any platform yet. Okay, and from my little knowledge of homeopathy, I know that there is no such study which compare and contrast the different school of thought talking about thermals and take a message. So your participation is very important. Please unmute yourself and tell me what is the name given for this thirst and thermal or physical constitution. Physical generals. Yes, Narenji, you are absolutely right. Anyone else? A kind of bookish answer. The word that we don't hear usually in the our contemporary books, but it is in the textbook. It is called as potential difference. Have anybody have used or heard about this word earlier? Potential difference. Okay, so it is called in that way. Somewhere in repertory book you'll get. So I think you are getting my point that only single thirst contradicting, only single thermal contradicting. We are going to give a patient phosphorus and he is very obese and chubby instead of tall and thin. We should not straight away eliminate them. Okay, give a second thought, because matching of the core essence PQRS is important. Okay, now here is some reference from, I think this is from Philip Bailey. What Philip Bailey is saying is that several constitutional types are prone to anger and tearfulness premenstrually, including natrum, sepia, lachesis. Just a minute, I'll click here so that it becomes full screen. It is already full screen. It is almost full screen. Dr. Shilpa, can you read it?
Yes,
you
sir.
are there.
Yes, yes. Tearfulness before menses. Several constitutional
Yes.
types are prone to anger and tearfulness premenstrually, including natrum,
Yes.
sepia, lachesis,
Right.
and alumina. When tears are clearly being suppressed, natrum is most often the constitutional type, whereas when tears are freely flowing and the temper is sudden and intense, both sepia and lachesis should be considered and are usually easily differentiated on account of the former being chilly and the latter hot-blooded. Shall I read again, sir? However, there are many cases in between with some tearfulness, some irritability, and occasional temper, where any of the above types of the others may be indicated, and the other features of the case will be more helpful. Sepia is often indicated when the woman complains of becoming another person for a week or more before her period, during which time she is variably fired. What is this? Friendness, snapping at anyone.
At anyone.
At anyone,
So
yes.
kind of see how beautifully the description is given here. Now the thing is that what they are talking about is easily differentiate on account of former being chilly and latter being hot. Sepia chilly, lachesis is hot, but we have seen from the very authentic references from SR Phatak that This is not so easy to differentiate. Okay, so uh, if you again see the last slide, okay, this slide, we have we come to understand that the core essence PQRS is the most important. Thermal thrust are there just to help. So if so, as P. Sankaran has said, that if single modality is just contradicting, okay, don't just eliminate that. Give a second thought. Give a proper understanding of the core essence and then go for the remedy, or you might miss the simile. Okay. So for all practical purpose, the five important options that we have is hot towards hot, chilly towards chilly, and of course ambithermal. But there is effect of pathology also on thermals. So when I went to study deeply about the different pathologies that can create changes in human body, first of all, fever, everybody knows. So because the fever patient is very much feeling very much hot, his body is very much heated, we will not labeling it always hot, isn't it? Then overactive thyroid, hyperthyroid. So increases hormone production, causing faster metabolism and much more heat. Hot flushes. So exactly like we are experiencing many of our patient in the menopausal period, there also because of body's pathology, the thermals are changing towards heat. So these are all commonly found pathologies or clinical condition where thermals are changed to hot, right? So while labeling patient as a hot, we must keep in mind that it can be a medicinal side effect. It can be a lot of dehydration. It can be due to the anxiety. Anxiety can also feel flush. Of course, heat stroke. You must be knowing that yesterday only a famous superstar of India, Shah Rukh Khan, has suffered with heat stroke during IPL match. So every patient who is coming with heat stroke will be definitely saying that I am feeling heated. So because he's feeling heated, because he's feeling hot, because he has a lot of warmth inside him, you should not label him as hot and rule out chilly remedies. Remember, for heat stroke, one of the important remedies belladonna, which is a chilly remedy. Chilly remedy, right? So this clinical condition list which I have made, I hope this will be practically useful. Take a screenshot of this also. Then opposite of it is hypothyroid, first and foremost condition. Anemic can also feel chilly. Cold extremities in diabetes. Don't mistake it as a chilliness. Reynolds phenomena where fingertips turns cold. Eating disorder because body conserves energy, potentially leading to feeling cold in the anorexia. Again, medicinal side effect. Again, low sugar level and sepsis. Okay. So this is a list. First list is of common terms, and second list of common terms where patient become chilly. Okay. So before moving to the next topic, important uh, remedies and their thermals, please unmute yourself and let me know whether you are clear with this clinical condition. Yes or no?
Yes.
Thank you so much. Okay. So many times we get a patient with hot flushes. Now I'll tell you. Interesting. We will take some screen break so you can see me and we can have communication for a while. So I'll tell you one small case. A middle-aged lady came to me. She said that she was advised a strong hormonal therapy, hormone replacement therapy to be very specific, HRT, which is usually given for menopause. Second point was obviously what she was having is a constant episode of hot flushes, like 15 to 20 times in a day. It used to come for a few seconds, whole body is feeling flushed and hot, and again it used to disappear. Okay, that is the first point. Uh, her daughter is doing physiotherapy, and they have only daughter. Their husband's financial condition is not very good. So constant thought on her mind was how to fulfill the demand of her daughter's post graduation in physiotherapy, that is PT, So she has done BPTH, and now she wants to done the post graduation from the Sancheti Hospital, and they were asking for a huge sum of money. So that was in her mind. Second point. Third point, she was very much, a well mannered, educated woman. That was third point. And main complaint was this hot flushes and hormone replacement therapy. I have given remedy within just 2 to 3 days. The entire episode of hot flushes, like 30-40% decreased. In the first follow-up, it was decreased by 90%. Yes, 90%. And for next few weeks, he was absolutely all right. It has been, months after that, she was working. She was responding well to the same remedy. And this remedy is one of the most chilly remedy in homeopathic mud remedy. Okay, can you guess the remedy? The chat box. It was arsenic. Okay, arsenic. Interestingly, if we go to the repertory, I think I have to share the screen again, right? Yes, the remedy help was arsenic. Okay. Now, interesting thing is that if you look into the repertory, like climacteric period, climacteric, or or menopause, flushing, heat flushes, menopause during. We have a long list of remedy, but nowhere you can see arsenic. Okay, so this is a different point, but the important point was that if you see any menopause rubric, I am still searching. I'm still searching whether they have mentioned arsenic anywhere else or not, because patient has mood sequences, there is restlessness, there is this hot flushes, general menopause. In the general menopause also, there is no arsenic. Okay, elements from. I'm going to the female section. In the female section menopause also, there is no arsenic. Okay, so I think what to say about this. The moral of the story is go with the totality, right? Okay, so again we'll go to my presentation. So can you see it, Narenji, Shilpa ma'am? Is it visible?
Yes, sir.
Yes, sir.
So don't miss this long list of clinical conditions, which can again mess up your choice of thermals. The initial, so I have used very common terms, not medical terms, common terms. Okay, even those who has not very well versed with clinical condition, they can also understand this. Now we are discussing important remedies and their thermals that we have already discussed. Pulsatilla. Pulsatilla, if you open our favorite Dubey book, in that Dubey book itself, Dr. S.K. Dubey, another pioneer in the field of homeopathy, the person whose textbook we are using in our college since our college days, has written all the confusion that is prevailing about pulsatilla's thermal. Some say it is chilly, most says it is hot. What is very confirmed is that they feel better by open air, right? So still we haven't categorized, or Dr. Even Nikamson haven't categorized pulsatilla into something like chilly or towards chilly. They have given it as a completely hot. But let me tell you, from n number of patients, that these are pulsatilla patients are the one who make you most confused in every aspect. I think Roger Morrison in his desktop guide has given very beautifully that the patient, one of the most confusing patient to you is pulsatilla. And when you see your case record, you might feel that there is no head or tail about this pulsatilla patient. There is so much vagueness, and the same vagueness thread is also reflected in the thermal aspect. Right now, in front of me is a list of hot and chilly points about pulsatilla. So, of course, pulsatilla is aggravation by warm covering, aggravation by warm, cloudy weather, aggravation by hot weather, aggravation by sun, better by cold air, better by uncovering, better by cool room, better by cold in general. At the same time, pulsatilla has aggravation by air draft, aggravation by thunderdrum, aggravation by cold air, cold bathing, aggravation by getting wet. You know, menses suppressed from getting wet. You must have heard about this. Then aggravation by wind, warmth, and long list of chilly aspect also. So what these things shows together? Again, if you are adamant with the fact that no, pulsatilla is hot and how we can give pulsatilla to the chilly patient, you will miss a lot. Okay, so look for the essence, keep thermals. Arsenic, just I have told you, in the cases of menopause, in many other cases, arsenic is very well known for trio of, what is arsenic well known? Trio. Yes, can anybody unmute themselves and tell me what arsenic comes in the trio of
Hello, sir.
we interact?
Arsenic comes in trio of restlessness.
Excellent. Who has given the answer? Can you tell me your name,
Sonali
please?
Atoy. Sonali Atoy.
Yes, Sonali, you are right. It is in the restlessness. Anything, any else point about arsenic?
Trio of burners, sir.
Who has given this answer?
Sir, Dr. Swati.
Swati. Okay. Now, this answer is what I want here, because see, burning is related to the heat, is related with the warmth, right? And because of this heat and warmth, we might consider that because patient is talking about very much uh, burning aspect or warmth aspect, we might overlook arsenic because it is a chilly remedy that is imbibed in mind. Okay, so next is Naxomica. I have told you in very start of this session only about Naxomica. Nattermoor. Nattermoor is mostly considered as a hot, and it is a hot remedy. But again, there are some aspect of Nattermoor which will surprise you, as Dr. Sankran sir has also written. Aggravation by cold, becoming cold, cold air in general, amelioration by what, and aggravation by cold, wet weather. Okay. Now, next factor is thermals in acute. So we will be summarizing this topic in next 10 minutes, right? And coming to the conclusion. So, if you take a point of intermittent fever, if you take a point of intermittent fever, then usually every intermittent fever patient will tell about 3 phases. Can anybody tell me about that? The phases told by
Hello, sir. Chill stage, heat stage, and sweating.
hello, are you there? What are the 3 phases that are crucial in cases of intermittent fever?
Chill, heat, sweat, sir.
Am I visible and audible?
Yes, sir.
Okay, not audible. Yes, yes. Okay, what I will do, instead of that presentation, I will open in few minutes, right? Because the interaction is very important. Once I cannot see you, it will be very difficult for me to understand whether you are in tune with me. So, okay, as I was told you, next 10 minutes we'll summarizing this important points. Okay. So, Bryonia is well known for its heat, unusual heat. From since our introduction to the homeopathy, we are quite clear that this is a hot remedy, but it has a chilly aspects also. Sometimes, especially in intermittent fever, bryonia presentation is chilly. Okay, chilly means it has prominent chill stage. So don't rule out bryonia simply because the patient is coming to you is in the chills, right? Similar story goes for the aconite. I remember clearly the incidents when my wife has been bitten with an insect and she was screaming restless, and finally we have to on the fan, and uh, in this desperate condition I called Nikam sir, and within a second he told that you should give aconite. Okay, he asked me that is she is hot and chilly. I said that sir, she wants fan right now. But within a next second, sir told that it is aconite that you should give, considering the present brutality and bite and restlessness and panic, and knowing her original nature and all. And within few minutes, she slept well. Okay. Now, what I want to emphasize in your mind that in this such acute emergency case, if the thermals are clear, okay, well and good, take it. But again, core is restlessness, pain, and panic. Okay, if you miss this core, and if you go obsessed with thermals, now patient is hot and give peace and give this and that, you might miss the session. Similar happens with the acute toothaches, nightly pains. No, patient comes, small baby comes crying that there is ear pain at night. This is actually a pulsate in the patient most of the time. Okay, nightly ear pain waking small children and disturbing their parents. Now this small child who is already in the crying mode, how they can clearly tell me whether it is hot and chilly, isn't it? So as I have told you, posed question in front of you whether thermal is an trap or compass. It should not become trap for you, it should become compass for you. So use it in that sense. I'll give example of last one remedy, that is belladonna. Belladonna, as I already told you, it takes cold from haircut. It is very chilly remedy many times, but at the same time, it is a remedy for sunstroke, right? So never ever conclude thermal from single symptom. Take a proper thermal totality. Ask direct question in this regard. Okay, don't ask whether you like winter or whether you like summer. No, liking is different. For example, I may like that Kulu Manali, beautiful romantic weather, flowers and all, but at the same time I might be very chilly. Who feels chilly? So ask whether you do use sweater or not. Okay, ask whether you take hot water for bathing or cold bath. You have to answer it objectively, and from that objective answer, make your opinion accordingly. Dr. Vijaykar sir. So this is the last slide share of the day, and that okay. So I have given you the caution in acute, and you might if that caution is not clear in your mind, you might land somewhere else, because in old days I have seen there used to be some a strange kind of charts like hot, thirsty, this group, chilly, thirstless, this group. This might be true sometime, but that should not form the core of your prescription. Hot, chilly, thirsty, thirstless are not core of your prescription. Like in this case, which I have told you just that anxiety, panic, restlessness after insect bite is the core, right? Whether it was hot and chilly is the secondary thing. Or I have told you in case of small child who is weeping at night due to the ear pain. So ear pain, night, these modalities are important, and this is the core of the case, not whether it is hot and chilly. Don't get obsessed with hot and chilly. Similarly, for the magmur, okay. So why we started this entire beautiful discussion? This is started with question that magmur is said to be chilly, and you have given is in the hot patient. Again, for the magmur, whenever this muriaticum component comes and when it is prominent, it turns out to be chilly, sorry, hot. Okay, this is one point. Now I am opening thermals of a magmur. And it is given towards chilly. See, chilly points are aggravation by cold air, cold, snow air, emulation by warmth, emulation by wrapping up warmly. These are all points toward chilliness. At the same time, patient has tremendous amelioration by open air. Okay, patient has aggravation from sun. Patient is aggravation by warmth, emulation by cold air. Now, how can we, neglect this aspect? Dr. Vikas Baulikar, are you there? The person who asked this question, Dr. Vikas, I think he's not there. So for our beautiful Magmur case, the first sentence I have written was, the patient was brought by his uncle. His mother was already died and father was alcoholic. This sentence itself takes you, or at least with this sentence, you should start thinking about the magnesium orphan condition of the child. And this orphan condition should form the core of this case, supported by thirst, supported by thermal. So in that case, the core was Corsican condition. Number one, nutritional problem, malnourished child due to the lack of nourishment from the mother. Then third point was pathology of GIT, that is pathology of diarrhea. So diarrhea, nourishment, orphan feeling, this is the core essence of the case, supported by this hotness or thermals or desire aversion and all. Okay, so if the thermals are contradicting somewhere, actually they are not contradicting because better by open air is a clear cut there in Magmur, but if at all it is contradicting, don't miss it for the core. I think with this we can move to the last slide of the day. Now this is a beautiful compilation of the hot and chilly remedy from Dr. Vijayakar's group. So you can see gelsemium is hot in general. Again, in the next list, gelsemium is chilly in acute. So there are some in bracket. I will discuss it somewhere else because it is already an 11 a long session, marathon session. But you can see there are some things about hot and chilly given beautifully in this chart also by Dr. Vijayakar's predictive group. I'll post it in group. Don't worry about that. So final notepad, the end note about this, make your own list. I have seen a list of Dr. Vishal. He has created very beautiful list. Make your own list. Keep on adding the points that you encounter in the way. Like you come to read about ipecac from the Fatak that it is affected by both hot and cold. Make a point. Keep it in your mind. Again, the important slide of the and final slide of the presentation is understand core essence and PQRS, and let this thirst, thermal and constitution should come to support you to take to the simillimum, not to make an obstacle or the trap in your prescription. I hope with this the things are very clear to you, and it is amazing to see so many attendees still there. More than 1 hour is really a long time, but I think this is also a short time. I would like to speak about this for 1 more hour, especially minute variation of each remedy, like in a case of psychiatric, in a hysterical cases, in cases where there is very acute emergency. Actually, we have talked about acute, but I think this is more than enough. If you have a very quick question, please put in chat box. This presentation, it took me a lot of time and efforts to make this bird eye view of thermals. I'm sure once again that you will never anywhere you find it in the YouTube or internet where such as minute contrast and comparison between different school of thought and a takeaway message that is core essence is important. Okay, with this end note, I'd like to end today's session, and again want your requesting you to please post on our group the slides that you have seen, the point you like in today's session, and of course any word you want to have right now. Someone was trying to unmute themselves.
Sir, for some reason.
Yes,
So I have
Parshuram
a
Patil sir.
question.
Yes, welcome your question, please.
Sir,
Can
if
you
a
open
patient is being
the screen? Can you unmute your video also, if you want? So that,
if the patient is hot, like
yes.
for some chronic
Okay.
ailment, skin complaint, if the patient has come and thermal is supposed to be hot, and
Okay.
over a period of after 3 4 months of medication, he comes up with an acute, and where the thermals looks to be chilly. So that time, what to consider?
Very important, very practical, very relevant question. For example, I have a case of a psoriasis for whom I am treating with natramur. He has a huge patches, and with natramur, it has vanished like surprise for him also, and for us also, pleasant surprise. And then came the same patient with a severe chills. Okay, then the chills went away, comes with lot of heat. Then the heat went away, and he came with perspiration. So typical, classical picture of malaria, severe chills. Our remedies, hot. What to do? Can anyone tell me? Should we give same remedy or different? Or should we have a thought about its chronic remedy or go for the next remedy? Or should we completely keep natramur from our mind away and go for the fresh totality? Parshuramji, the example I cited, is it relevant example?
Yes, sir, it is very relevant.
So here you will, actually I want to show repertory some point. Intermittent fever, for the intermittent fever, Renji, can you for a few seconds allow me? Narenji, are you there?
Mm.
So I want to show one rubric from. So for this condition, the simplest rubric is intermittent fever. Okay, anyway, intermittent fever, and you will surprise to see for the intermittent fever, one of the most indicated remedy is nothing but natramur along with, okay, can you see here natramur, Parshuramji?
Yes, sir, I can see.
Yes. So we might feel that natramur was hard. Our patient is coming into the chill stage. Now, should we consider natramur or we should not consider natramur? The simplest answer is first review the case. Okay. First review the case. Take up properly if your time permits. If he's becoming chilly, okay, it's always better to give next possible remedy and not stuck up with the same chronic remedy. Okay, but it has been found that this acute many times is either the same chronic remedy, so you can even thinking of giving one dose of the same chronic remedy. Sometimes it is that in the relationship. For example, chronic is calcarea, acute can come as a belladonna. For example, chronic is, some other remedy, acute can like sepia, acute can come as a rustox, somewhere related with them. Okay, for example, chronic is again sulfur, acute can come as a aconite, so aloe sometime. So there might be some relation. Better is to review the case and consider the present thermals. So even in this case of fever with chronic psoriasis treated with natramur and now coming with chills as an acute, consider present chill heat stage, but you must have knowledge that we can label this as an intermittent fever and look in the repertory accordingly. I think the point is very clear. Go for the present one, right? Any other question?
No, sir, I'm very clear. Thank you.
So it's time to wrap up. I hope you enjoy the session, and as usual, uh, my expectation from you feedback on our group. Please put in the chat. It took almost 2 weeks. We are meeting after 2 weeks instead of weekly session, but this topic was very important. I hope you got good idea and apply it in your practice. So it's time to say good night. We will meet soon. If you have any question, you can put on the group. If you have any question, please put me personally also. And of course, what you like most about today's session, about different group study, about references from the pioneers, about acute, about chart, please put on our group. Okay, it's time to say good night. Thank you very much for patient learning for this long session, and thank you Narenji for being host of today's session, and
My pleasure.
allow me to use your WhatsApp, your Zoom account. Thank you so much. Thank you, Shivani. Please put on the group. It's time to say good night.